Hi, you guys. We are live here. Going to be talking about the vaccine. If you have any questions, let me know. We'll see you guys in 1 minute.
Hi-yo, 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 hey. Hi-yo, 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 hey. Hey-yo, hey, hey, hi-yo, hi-yo, hey, hey. Hi-yo, 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 hey. Hi-yo, hi-yo, hey. Hey-yo, hey, hey, hi-yo, hey, hey. Hi-yo, hi-yo, hey. Hi-yo, hi-yo, hey. Hey-yo, hey, hey, hi-yo, hey, hey. Hi-yo, hi-yo.
All right. That's such a beautiful song. That's a song by Maddie Baptiste of Red Pheasant First Nation. All right, you guys, welcome to a special two-part series. We did go live I think it was last month, with Dr. Khan, myself, and Deneate Willis Janvier. And we talked about vaccine, the importance of it. If you guys had any questions, if aliens were going to invade your body, if Bill Gates was going to take over your mind, all the questions were answered. Strange ones, good ones. But you know what? In the end, they're all kind of good questions because this was all brought onto us like this in a matter of days last year, March 2020. And now we're here. So we got Dr. Khan with us tonight. We got Bill Ironstein at BRT6HC. And we got Connie Dillon, a registered nurse, who will be answering your guys' questions. Everyone, you guys tune in right away. We're going to be probably for an hour, so we're going to get right to it because Dr. Khan doesn't have too much time. So I want to welcome on and on. You guys, this is on behalf of Ballarat River Treaty 6 Health Center in North Battleford. So I want to thank them for allow me to bring this podcast on. So, Bill, welcome. Can you hear me? Oh, I got to unmute you there.
I can. Thank you, Nathan. I appreciate you having me.
So, yeah, go ahead and say a few words here, and then we'll open it up.
All right. First of all, Battle River Treaty 6 Health, thanks you all for joining in and watching us this evening. We brought special guest Dr. Khan, who is Regional Medical Health Officer for Indigenous Services Canada, and Connie Dillon, the head nurse on the community of of Little Pine First Nation, who works for Battle River Treaty 6. Like Nathan said, we're still in the middle of this fight. The COVID is not over. Everyone is seeing the light at the end of the tunnel and thinking it's green and that we can go out and do what we normally used to do. But right now, that light is still yellow. It's caution. We need to stay with our precautions, our masking, our hand washing, our physical distancing. We have more time. We need to stay in this fight. And through people like Dr. Khan and his team, Connie and her team, we'll get through this together. Thank you.
All right. Thank you, Bill. So we got Bill there. He's going to come back on. And then, yeah. So if you guys have any questions, remember, feel free to ask them in the comments. I'll bring them up. And they can be as wild as you want. But make sure you mean that question. Because last time I was asking Dr. Khan about the Bill Gates thing. I was asking him questions I was seeing online and some I had. And, as wild as they are, there's a lot of people that do think in crazy ways, I'm not going to say crazy. So it's just how there's so much information out there and there's a lot of false information there. So it's best to bring the professionals on. So I'm going to bring on Dr. Khan, Mr. Bill Einstein with us as well. Dr. Khan, go ahead and introduce yourself.
Good evening, Nathan, Bill, Connie, Patty, and everybody in the BRT6 areas. Really happy to be with you. As Bill mentioned really nicely, the situation, a lot of questions, a lot of fake news, a lot of rumors circulating. So really appreciate that we have this opportunity to clarify some of those misconception or misinformation. So again, I'm very happy to be with you. My name is Dr. Ibrahim Khan, and I'm the Regional Medical Health Officer, working very closely with Bill, Connie, and the entire team in BRT6 in the communities and the Tribal Council. So very happy to be with you and have this opportunity.
Awesome. Thank you, Dr. Khan. So you guys, we're probably going to be about an hour here tonight. So hopefully you guys are tuning in. I went live on a bunch of my social medias here. So we got people watching all over. And then I apologize again. I'm on the reserve here and I'm battling every single day res Wi-Fi, hoping those satellites up there will bring me faster res Wi-Fi here sooner than later. But yeah, we'll get there. So I guess we're going to put Dr. Khan on the spotlight there. Dr. Khan, like before we started the show here, I was saying, you were asking me what questions I had. There's two of them I was telling you I had. There's two. One of them is the Delta variant that we've been hearing that's spreading like wildfire. It seems that every single time there's a new variant, that's the main word. The main word is they're spreading like wildfire and this and that. And okay, is this one more dangerous than the Brazilian and the UK and you know, I don't know what other ones are out there, but so yeah. So Dr. Khan, please elaborate on the Delta variant and how it is compared to the other ones.
Sure. Thank you very much for this opportunity. And once again, this is the most critical questions and critical area that a lot of people have a really fair questions. And I'm glad you asked that question first, because that's really critical when it comes to the COVID vaccine, when it comes to the COVID circulation in the community, but also the vaccine effectiveness. So a couple of things have changed in the last weeks or so. We used to call these variants the UK variant, the South African variant, the Brazilian variant, and the Indian variant, which we call Delta now. So the World Health Organization in Geneva actually chose these different ways to indicate these different variant of concern, which are the names are less stigmatizing, because if you say UK, so then certainly people's mind goes towards Britain. So this new way of disclosing these names or indicating these names have been adopted recently. So in all the communication we have, we use these alpha, beta, gamma, and delta variants. So so far in Saskatchewan, we are seeing mostly the UK variant, which we call now alpha. But we have seen cases of South African, which is the beta variant. We have seen cases of the Brazilian, the gamma, and now delta, which is the Indian variant. Recently, this name has been adopted to call it Delta variant since May 10th. This is certainly 600% more transmissible than the Alpha variant. So certainly very transmissible, can put people very quickly in the hospital, in ICU, certainly have a lot of severe complications if people don't observe these precautions. We have seen in the last week, we have seen a little increase in the number of Delta variant across Saskatchewan, but I'm very happy to say that so far we have not seen the Delta variant in our Indigenous community. So that is a very good thing. Most of the interventions that each community's tribal councils have adopted or put in place have really worked to stop the spread. We are seeing a downward trend of overall COVID cases. Hope we do not see the Delta variant in our Indigenous communities. And particularly when you look at these different variants and look at the vaccine effectiveness, certainly the vaccine effectiveness is there, but it varies particularly with the particular variant you talk about. So when it comes to Delta variant, the protection that you get from the first dose is like 30 to 40%. But if you get the second dose, then your protection goes immediately very high, 80 to 90%. So that's the very good news for countries, for jurisdictions where Delta variant is quickly circulating. So we just are taking this time to spread the word in our communities. And I'm really happy that this broadcast is happening so that we can spread the word that the key to the freedom, the key to the reopen is in the hands of our people in the communities. And I know that every community is working very hard to bring the first dose to the people in different ways. Some communities are having drive-through pop-up clinics. Some communities are going door-to-door, home-to-home campaigns, which certainly have brought the coverage or the uptake of the second dose and the first dose really, really high. So hope with this, taking this time, maybe this week and next week's, that we bring everybody up to speed on the second dose so that they have that immunity. And usually the immunity is adequate or boost up very quickly, but that full protection that you can really feel yourself confident that your body has developed or launched that immunity is 2 to 3 weeks after the second dose. So certainly we are asking people to observe those precautions. And also one really key note here is that certainly in elderly people with chronic conditions, they have to be really mindful that they still observe those precautions like masking, particularly in indoor setting, because it takes time to boost or to launch that or to develop that immunity after 2 to 3 weeks. So certainly there will be some precautions for some people, and certainly new guidelines were recently released, which we can talk about certainly if you have 2 doses and if you are re-exposed, what you need to do.
Yeah, that was another question I had in regards to when you get the second dose, the second vaccine, people are, I think it was just announced, correct me if I'm wrong, that if you're in close contact, because before it seemed like you were walking through anywhere. Oh, you were in like within 150 feet. You got to quarantine for 28 days and blah, blah, blah. But now it seems the rules are getting more lax and lax. I guess still kind of tough, but more lax. Is it true? Because I did hear it. I think I already literally seen it on Facebook. But I need to know if this Facebook rumor is true, that if you are in close contact, let's say in the same room, of someone who does have COVID-19 and you've already had your second dose for a month or 2-3 weeks, do you have to quarantine still?
So Nathan, you heard it correct. Yes, those announcements were made this week. So certainly public health is working around some of these new evidence and newly proposed guidelines. Some of it is still in the works, particularly when it comes to Delta and some of these really highly virulent strains. But what you heard is correct, but I have to explain that a little bit to you. And some of the information, if you dig deeper into this issue, are still in the works. So anybody who has received 2 doses of these mRNA vaccine, and 2 to 3 weeks have passed after the second dose, if you are re-exposed to the COVID virus or someone with COVID symptomatic infection, so you would not be required to self-isolate. But there is a little bit of explanation I want to provide. That would be particularly for people who are asymptomatic. If you are symptomatic, or depending upon your risk and your unique medical condition, or if you work in an ICU or in a high-risk occupation, certainly those people would be directed by public health to observe certain precautions. But certainly if you have 2 doses and 2 to 3 weeks have passed and you are re-exposed, you would not have to re-isolate or go into quarantine. So certainly for the Delta variant, there is a little bit of more details coming in the coming weeks, that how would we deal with different individuals with different immune system or chronic conditions. But certainly that blanket statement is correct, and that is the directions people will be following. Also, another really key recommendation coming into the public health practice is that what are the recommendations for people who had 1 dose of vaccine or partially immunized. So certainly there will be more information coming how those people will be followed up after they are re-exposed.
Awesome. We got a comment here. Question. There are many First Nation communities who are anti-vaxxers. How do we communicate to those who are misinformed to get the right information out there and be more informed? Are they higher at risks even if they are taking proper protocols?
So certainly, this is a very good question, and then please remind me if I forget some of the components of this question. So first of all, yes, there is a lot of misinformation, and the people who are anti-vaccine or anti-COVID certainly are very active, has been active throughout this pandemic. So in this sort of environment, when there are these fake news and misinformation circulating, our key advice to all our indigenous communities were that, and still is, that they follow the advice from authentic source, which is the public health in Saskatchewan. That would be like people like Connie in the community. Whatever she say or practice in the community actually come from the medical health officer, and we get it from a very scientifically proven, authentic sources information. So our information come from Public Health Agency of Canada. They get it from World Health Organization, and that information goes down to the communities in a very frequent, simple way. We have frequent channels of communications of information, changing information about the virus, changing information about the vaccine. New directions were coming every week, and those informations were routed through the nurses from our office on a regular basis to the chief, to the health directors. So I think that is the way. And so if you are looking for information about the COVID virus or about the vaccine, hopefully you are looking at the Saskatchewan Health Authority website, Ministry of Health website, Public Health Agency of Canada, or Indigenous Services Canada, or go to your own local tribal council or Facebook page. Actually, they post very authentic and accurate information. So that is certainly one way to get access to the most accurate and scientifically verified information in these environments. And what was the second question about the?
Are they at higher risk even if they're taking proper protocols? So basically wearing the
Yes.
mask, washing hands, all that stuff.
So basically, when you compare our Indigenous people in Saskatchewan with the non-Indigenous people, and we have said that all along in this pandemic, that Indigenous people are twice highly likely to get COVID and have the complication from COVID. So the risk for Indigenous people is higher, and I would explain that why. Number one, most of our Indigenous people have access issues. So again, diagnosis has really improved. So there's a quick testing available, but certainly there are times that people are not very forthcoming for testing. So again, delay in diagnosis, but also the major factor that our Indigenous people see most of these complications and ICU admission and eventually, unfortunately, death is because our Indigenous people have a lot of multiple chronic conditions, and also hard situation, overcrowding, and those sort of things really expose them to added risk. So that's where we want to spend more time to help people understand some of these added risks. That whenever you are diagnosed with COVID, you can immediately isolate, you get the appropriate advice, and then also not only looking after that person who has COVID, but also in an overcrowded setting when there are 10 to 15 more people living around you, you have to certainly look into their situation as well and protect them as well. So certainly those closed environment, overcrowding, increase the risk of re-exposure as well. And that's why people are re-exposed and then they extend their isolation. But also I have seen many communities come off one outbreak and enter after a month into another outbreak. So that recirculation of the virus is really critical, that we take every step that people are protected, people have the right information, and they get the service they need, and they get the quality service they need. So that has been quite an effort in all our communities throughout this pandemic.
Awesome. Thank you. Everyone that's watching right now, and if you're an anti-vaxxer, you know, I really encourage, and I'm not trying to start something here, but I really encourage you to ask the questions that you think are proper to ask right now. We do have a doctor with us that could challenge your thoughts and all that we can get to the bottom line, the truth. So I really encourage you, if you are one of those people that do not want to get the vaccine, because whatever you think, please ask questions away in here in the comments, and then Dr. Khan will for sure answer them. I got another question. Will the new variants ever end? Will this ever end? I've heard that we are looking at this for the rest of our life, possibly almost like the flu shot, that we are going to be just getting the needle every freaking year, and just forever. And we just got to get used to it, where our bodies, I guess, are almost going to be immune a couple decades down the road.
Yeah, good question. And a lot of things are really, really unpredictable in this regard. Based on the current science, the current evidence from many countries, including United States, United Kingdom, and Israel, and now in Canada, there is a growing evidence, and really solid evidence. And now we have our own evidence. We presented to the chief and to the health director this week, and there's a clear evidence that the areas that see an immediate increase in the uptake of first and second dose, that's where you see the COVID numbers decline very significantly. So that is a very good thing, that the vaccine is effective. And people who are vaccinated and have received the second dose, we do not see them get reinfected or get sick again. So that is a very good evidence, and that is the evidence we are believing in. Another really convincing evidence is that higher uptake of the second dose is the key to eliminate the variant of concerns. So if we have higher uptake for the second dose and we achieve 80 and above, then certainly we're going to eliminate all the VOCs. And if you do that, if you apply the same sort of approach globally, then certainly globally we're not going to see a variant of concerns. And if you look into all these major variant of concerns, they actually came from somewhere else. So till everybody in this world is protected with the vaccine, we are not protected. So I think protection at home is one thing, but vaccination at home with the second dose is one thing, but vaccination outside, in other countries is also equally important. That's why recently in the G7 meeting with all the, the key leaders around the world from these G7 countries have actually pledged that they would like to donate some of the vaccine to the rest of the world, because till you vaccinate everybody in the rest of the world, even if you have vaccination high level here, we are not safe. So I think that is the intent, and that sort of approach is going to eliminate the VOCs. There is one really emerging notion that we believe is going to be more and more coming, and that is that we have to live. We have to start. We have learned a lot, by the way, throughout this pandemic. We have learned in the 3 waves that we had no vaccine with us. So basically, some of these non-pharmaceutical interventions were really effective. So that did help to stop the spread. Now we have the vaccine plus those non-pharmaceutical intervention like masking, distancing, isolation. Those measures can really help us get rid of the COVID and the VOCs. So if we have that approach, certainly we are not going to see more and more virulent types of these viruses. But again, there is one thing that the whole world is preparing itself, that we have to learn to live with COVID somehow. And that is going to be the notion we're going to be following. We're going to be monitoring that when we achieve globally, and in particular in Canada and our Indigenous communities, that high level of second dose, you're going to see quite a dramatic decrease in the VOCs. And already we are seeing that communities that have a higher level of uptake. I have communities that have actually 100% uptake for the first and second dose, but I have communities as well in Saskatchewan that has like 40% and 30% uptake for the first and second dose. And that's where we see cyclic outbreaks happening one after the other. So 1 month you come out of the outbreak, the next month you enter again, because there are still pockets of unvaccinated people. So till we vaccinate everybody, unfortunately, we are going to see COVID around.
It's kind of like living with an ex-girlfriend around all the time. It's always going to be there. But
Yes.
all right. So another one from Daryl, and then we got Brian Howard with another comment. Are the First Nation communities translating and transcribing the information to get the right information out in Dene, Cree, Nakota, Soda, etc. on the effectiveness of the vaccinations? COVID is not new and has been around. So basically, are we using our First Nations language to translate exactly what is going on?
Yeah, and I would give you the example of the Battleford Treaty 6 areas elders, and our elders have spoken. Our elders, particularly in the BRT6 areas, are one of the unique, resource they have developed, particularly in indigenous languages, an indigenous way of expression. They have come up with those posters, which has received an attention and admiration and appreciation across Saskatchewan, across the country. So yes, that is happening. Every community is going to put those messages in their local languages, and also the local leaders have spoken about it in their social circles and in their podcast and social media. But again, Connie and Bill can speak to that as well. Like, what do they see how these languages are being used to communicate with people on the ground?
Awesome. I just want to read this one real quick. Imagine how long we lived with the mumps, measles, chickenpox, Nathan, before we developed treatment. A long time ago, I'm guessing. Living with the COVID for a few years is simply a blip. It is true. That's what I was trying to say. I knew the answer, but there's a lot of people that they're just wondering how long this is going to go on. So take the long road, the long picture. The new Myrna vaccine allows us to produce effective vaccines in a month or so instead of years on years. That is true.
That is totally true and very valid statement. And I think the mRNA vaccine is giving a lot of new science, new technology, new thinking to other viral infections. Particularly HIV is on the horizon, that they want to use the same technology for HIV and other really infections that doesn't have a cure right now. So I think this technology and this experience that we are gaining from the response to the COVID-19 situation certainly is going to help everybody focus on other major issues as well.
Yeah. Awesome. Thank you, Brian. If there's any more questions, you guys feel free to ask Dr. Khan. He's got about another 7:30, Dr. Khan.
I'm staying with you for another 10 minutes.
Oh, another 10 minutes here we got. So if there's any more questions you need to ask Dr. Khan, feel free to ask away. We have registered nurse Connie Dillon that'll be coming on right after this. So lots of information, and we are going to be doing another one. When are we doing the next one?
I believe on the 30th, if everybody's schedule works out.
Yeah, June 30th will be the next session that we're going to be doing this with COVID. And I think, I think going back to this question here, and I know you guys are reaching out, I think that's such a great idea that if we do, because I know my buddy does one, Denny Yati, who helped me last time. He is Denny and he speaks his language, do them all in Dakota. So, Sue, whatever you got to do to get that mass information out here, because we all reach each other like this right now. This is how we do things. This is the new norm. How worried should we be in the end? If we are vaccinated, I forget what I was seeing this, but people are saying you can still die if you catch COVID, even though you got second vaxxed. What is the percentage of that? Or is there even a percentage right now that you know of when you are vaccinated if you catch COVID again?
Yes. So this week, if I may say just quickly, this week we shared with our health directors. I think it was this week, and also last week we shared a slide in our presentation, which is the evidence is coming from Ontario, a very solid evidence that give you immunity information about immunity in different age group after the first dose and the second dose. So the evidence is pretty solid, and now there's a new evidence that initially we said, based on the evidence actually that came from the World Health Organization and some of these countries that were well advanced in vaccine rollout, that the COVID infections or the COVID vaccine does provide 3 months of that immunity, but now there is an evidence that actually that immunity is more than 6 months. So I think there's a lot of new evidence coming. There's a lot of new evidence coming stating that COVID vaccine does protect you from getting into the hospitalization and severity and symptomatic infection. So I think there is a quite a convincing evidence, and because of these new evidence that is emerging from the population-based rollout, that the vaccine is also being considered safe for children. So as you have seen in each month, there was new information coming and the expansion of the COVID vaccines to other age groups. So currently, we are very lucky that Canada is one of those countries that we have abundant vaccine, and that vaccine is now made available and very, very effective for children 12 and above. So that's another very key piece we want to focus, that now that we have protected the grandparents, the parents, and the teachers and everybody else, now we need to focus on 12-year-old and above, that they get their first and second dose. And by the fall, there is a very eminent trials and information coming that it will be the COVID vaccine will be used in children under 12-year-old as well. So I think by Christmas, I think there's a lot to unpack and a lot to do till we really 100% reach out to all population, including the children. So I think the evidence is very strong, and that evidence is actually helping public health roll it out to other age groups as well, including 12-year-olds and above now. So I think that is the focus now for the program.
Okay. We got some questions.
Nathan.
Oh, yeah.
Sorry.
Go ahead.
I'm reading the questions, and I know they're all good ones, but I think Roberta's question down there at the end is something we need to bring up to the doctor. Is
Okay.
the clinics and that I've been working, I've been hearing this a lot from people.
All right, there you go. If you got sick from the first dose, should you get the second? And just to be clear, I've got both of my shots. My first one, I got a little nauseated. Other than that, I was good to go. My second dose kicked me in the butt hard. I mean, sick, side aches, headaches, sleepy, had it all. But I was
Okay.
good.
So the answer to this question is very simple, but it depends. So first of all, if you got the first dose and you just got the soreness, the pain in the arm, fatigue, headache, mild fever, mild symptoms. So yes, we would recommend that you go for the second dose, but every side effects, every adverse events after the first dose is reported. So for example, if you had a severe allergic reaction, so certainly that would be reported to the nurse. The nurse would report it to me. We discuss it. We discuss all in-depth sort of aspect of the adverse event and the side effects in each situation. And if we feel that the second dose is safe, even if there are mild side effects, we would still recommend that the benefits are more than the risks. We would still recommend that people get their second dose. But here, what I want to say is that each side effects or each adverse event after vaccine is reported. The nurse and myself go through all events very carefully, and then we give recommendation to that person whether the person should go for the second dose or not. But if it's a mild sort of side effects like fatigue, headache, mild fever, pain in the arm, or any other mild symptoms, that should be reported to the nurse. The nurse will do an assessment and give you a recommendation for whether or not you should go for the second dose. But I think for mild, absolutely, we would recommend people to go for second dose. But if it's a severe allergic reaction, or a person was hospitalized, was taken into an ambulance to the hospital, like breathing difficulty, systemic reaction to the vaccine, then in those situations, we carefully would advise that individual. But if it's a mild symptoms, then of course people can get the second dose, and they would have to talk to their local nurse.
Awesome.
Yeah, just to add to that, Dr. Khan, BRT6, we've given over 1,800 doses, and we have not had a severe reaction in any of those doses.
Awesome.
Yes, thank you.
There you go, Roberta. That was a good question. See, questions like these, just be straight up, you guys. There's no stupid questions, and they can be from far out. Like I said, I was asking last time we were on about Bill Gates and all that conspiracy stuff. Any question is a good question here about COVID.
And Nathan, I want to say that a vaccine is very safe, in pregnancy, in people with HIV, people with chronic addictions, people with chronic condition. So the vaccine is considered very safe, but there is a little bit of check and balance that the nurses would do. So anybody who is on cancer treatment, active cancer treatment, certainly those we do go to the specialist and get the permission from the specialist, whether anyone who has a unique special conditions that we get the approval from their specialist before we proceed. But the vaccine is considered safe in all sort of these major chronic conditions, pregnant women, breastfeeding, those sort of things considered safe. And that is the reason that, the vaccine is also now recommended for children. So there's a lot of safety, high safety profile of the vaccine. And by the way, I must say that this is one of the vaccine that is in the most public lens. So anything about this vaccine, the ingredients, everything is public. That information is available. Nothing is secret about this vaccine. All these rumor that, the injection site, the bulb would flash if you put the bulb on the injection site.
Oh, that's a new one.
Yeah, and that there is a microchips in it, that it causes sterility and infertility, and that it causes infection. Yeah, and a magnet. All these are fake news and have been proven by BBC and CNN and World Health Organization that these are fake news, and people shouldn't forward or shouldn't share that information. Because if you live in a small rural town and you don't have access to the healthcare provider, certainly that can have a very negative impact on people's choices.
Awesome. I want to do this. I know, Dr. Khan, you got to go. I just want you to answer this one, and then we'll let you end it. Say a few words after that. I personally believe that you can't compare the flu to COVID-19 because COVID-19 is so new. What is Dr. Khan's view on that?
And that is very true, that we know a lot about flu. But I think the level of scientific focus on COVID, we have learned very quickly a lot about the COVID virus as well. So if you can see that the amount of research, the genetic, sharing the information globally about the genetic makeup of the virus is one of the most scientific marvel of this, current time. So we do know a lot about COVID, and the COVID is very impactful compared to flu. So that's why, and another good thing that the COVID vaccine is far more effective than the flu vaccine. So I think there are a little bit of differences, but I think we have learned a good deal of knowledge on the COVID in a very short period of time because of this global unified focus on the COVID vaccine. But certainly we're going to be learning more about COVID, because as we vaccinate more and more people like 80 and above, we're going to see how the dynamics is going to be about the COVID globally. And I think globally it will take time to reach that level that we can see a real stop to the spread of the COVID. And certainly this flu season will be a trial for all of us, because we will see a decline in COVID. But last year we did not have a single case of flu in Saskatchewan. So that speaks to the measure that people are taking, like, masking, distancing, hand washing. Those are the key things that help for flu protection as well, flu prevention. So I think this is going to be a very interesting fall and winter time. We're going to see how these two viruses will live in that, close proximity to each other. And certainly last year was a very surprise year for all of us in public health, that we did not see a single case of flu in Saskatchewan. So certainly a lot to see how COVID and these two would interact and react to each other. And let's see, this flu season is also a mild or no flu and no COVID as well this season.
I just want to add to that, because this is part of the conspiracy thing. And then I got some conspiracy theorists on my Facebook, and I see them posting stuff all the time. One of the things they were always mentioning is that it was such an amazing thing, and they were being sarcastic about it, that there was no flu. You guys got to realize too that we were wearing masks and we were ultimately, everyone is just trying to be as safe as we can. And I think that obviously attained to why there was no cases, like at my school where I work, no one had the cold. Like there was nobody that was sick. There was a few people that caught COVID, but other than that, everyone was just as healthy as they can be, right? So I mean, it's all of us just being safe and
Yeah,
everything.
and the public health order that actually put really enforcement into this, that people are not able to congregate, and even in the long-term care facility where we see the majority of the deaths, the majority of the cases come in the long-term care facilities for flu. That wasn't the case because everybody was extremely vigilant and everybody was trying to put those precautions in place. So that did help. And this year will be another trial for us to see whether we are going to see flu because of people out and about and congregating and mixing up. But certainly the public health interventions that were in place, the public health order, did help a lot to put those isolation and segregations among people, and that is the breeding ground for flu as well as for COVID.
Yeah, before COVID happened, a lot of us were, man, like I've never washed my hands so many times, and now even like things are more lax. I'm still very cautious. Like when I touch a hand or something, I'm not touching my face anymore. I'm like washing my hands, and it's like we're more aware that there's a lot of germs out there, and I think that's how a lot of germs are passed before because we were just like so careless, like grabbing anything, touching our face and stuff. So yeah.
And I think that these practices, and these habits that people have adopted to protect from COVID will definitely help against flu and many other respiratory infection as well. So I think these are good practices, and we were recommending these practices for all along, many years. But COVID brought everything to a spotlight, and people understood that what it takes to spread the COVID virus was actually the same that flu spread the same way. So I think there was a clear evidence on that as well.
Do you have to go? We got a couple more questions. I don't know what you want to do.
I will attend some of your questions. Yes.
Oh, okay. We'll start with Daryl. Well, I got Daryl, Roberta, and then we'll finish with Brian Howard there. So Daryl goes, what is the Canadian healthcare system and provincial healthcare systems doing to prepare those affected by COVID for those requiring long-term rehabilitation from the virus?
Yeah, so some jurisdictions, particularly Quebec, Alberta, and Ottawa, the Ontario system, they did see a lot of people with lingering symptoms, like long-term symptoms, cognitive disabilities, and memory effects, and these fatigue syndromes. They did see those long-standing lingering effects from COVID infection among some people. So what they did is that they hosted special clinics. They call it long haulers, or COVID clinics for long haulers, or chronic COVID-related symptoms. So they had specific dedicated clinics in which it was a research project too. They wanted to see that the COVID symptoms. They wanted to monitor and track COVID symptoms among people who had COVID, and how long those symptoms last, what can be done to address those symptoms. So I think there was very specific targeted approaches in Quebec, in Alberta, and in Ontario. In Saskatchewan, we are watching very closely. Particularly, my connection is more with the Indigenous world. Our northern colleague, myself, South Central First Nations communities, we were watching every case that was reported in terms of long-term sequelae, long-term complications of the COVID. We are watching that. We are collecting that information, and we are also doing whole genome sequencing on them just to understand the COVID virus, like which COVID virus was that, which variant was that, where did it lasted the long. In some of these patients, and what symptoms were the most severe one, and what symptoms did last longer or did relieve quicker. So that information we are collecting, but the good thing is that I'm not seeing a lot of those sort of patients in our population. And the provincial system is certainly gearing for a number of things. We want to do, a surveillance in Saskatchewan. It's just a provincial sort of surveillance system that they will see how the COVID virus have impacted on the overall population and what sort of immunity was there post and pre-vaccine. So certainly there is a lot of efforts into that to find out more about the short and long-term impacts of the COVID-19 virus on population. So certainly at the national level, the Public Health Agency of Canada and the provincial system, and so are we for our Indigenous system. We are watching and monitoring those information very quickly. And certainly there will be more to come in the coming days. Even the vaccine rollout, that information is very carefully captured, and particularly which vaccine, who had reinfections after post-vaccine. That information is very carefully collected. We want to see and review that information, and there will be a lot of reports coming in shortly on that about different population and their response and reactions to those situations.
Awesome, thank you. Hope that answered your question there, Daryl. Sounded like to me it did. Hit it on the nose there. Roberta, and then we're gonna do Brian Howard's question after this, and then we'll move on to Connie Dillon. Do you believe the best vaccine? Do you believe that Pfizer is the best vaccine to get?
In many ways, the mRNA vaccine are preferred in so many ways, and these are the two vaccines that have been used widely in our Indigenous population, and we're seeing a great, very great impact and positive impact of these mRNA vaccines. I do believe in these vaccines. All vaccines are good. Certainly, there is more data and more high safety profiles of the mRNA vaccine from the clinical trial as well as from the population rollout. So certainly, I feel these vaccines are incredibly effective, very good, and very safe. And certainly, with the time, we're going to get more data in terms of long-term effects of these vaccine and how populations are reacting to that. But I do believe that the Pfizer, all the mRNA vaccines are the best vaccine in the world.
Awesome, thank you. Last but not least, Brian Howard. Do you think we will be able to use the Myrna tech for regular flu, or will it matter due to such variants already around, or maybe not even around anymore?
Of course, there's a lot of open thinking about what can be done for flu, and if flu can be gone like with just simple precautions, that we had no flu cases. I mean, this has never happened in the past, that we have no cases of flu last year and this year. This is an incredible evolution in the virus spread. So certainly all technologies, all options are on the table, and we're going to see whether there will be a separate vaccine or put them together or some sort of different ways to deal with this circulating viruses each flu season. So I think a lot of new information, new science is coming, and it's hard to predict what's going to be in the fall. So let's stay tuned, and we will share that information with you as soon as we hear.
Awesome, thank you. Well, Dr. Khan, I want to thank you for joining us once again on this podcast. You are a man of much wisdom in what's going on, and looking forward to the June 30th, I believe, but we'll post when it is the next one. It's around there that time. And it'll be, again, just about the vaccine and trying to get people to go back, get vaccinated. And yeah, so if you want to close out there, Dr. Khan, with a few words.
Thank you so much. I really find this helpful. And of course, every week we have new information. So I think by June 30th, I'm sure there'll be a lot of new information that we can share in the upcoming broadcast. But I think my only plea to everybody in the area is that please bring your families, bring your children, whoever is eligible for the vaccine forward. If you want vaccine to be provided to you in certain ways at home, or a different sort of, pop-up clinics, please express that interest to our nursing team in the communities. And, the nursing team is very receptive, very adaptable, and very flexible, and very respectful of the needs in the community. So I think if we can focus on the children in the coming weeks, and anybody who have missed the first shot, please bring them in. And if they have questions, please bring those questions forward. There is an answer for all the questions. If we don't have the answer, we will get you the answer. But I think there is a lot known now, a lot of confidence, a lot of faith in the vaccine that will bring us out of this pandemic. So I want to thank everybody's incredible efforts in the BRT6 communities and BRT6 Tribal Council, and all the health directors, the managers, the frontline responders, the nursing team. Incredible work, and there is no word that can express the gratitude for your hard work and the fact that you are making a big difference in people's lives and have protected them so well throughout this pandemic. So thank you so much, Nathan and Bill, Patricia, and Connie. It's an honor to work with you, and hopefully we'll be soon out of it and can see the normal life.
Awesome. Thank you, Dr. Khan, and we'll catch you on the next one there. So we'll see you soon.
Thank you.
Thank you, Dr. Khan.
All right. So there's Dr. Khan. You guys, man, it's nice to actually listen to someone who knows what they're talking about instead of seeing someone peel off on LinkedIn or Facebook or Snapchat or, you know, sharing stuff that just don't make no sense. He breaks it down to you. Right?
Yeah, when they say talk to an expert or listen to an expert, that's the man you need to listen to.
Yeah, you want to talk about crypto? Come to me. No, just kidding. I'm just kidding. But yeah, Dr. Khan, obviously the expert. And now we got registered nurse Connie Dillon, who is from Onion Lake but works with BRT6. So welcome, Connie.
Thank you. Good to be here.
She was on our show last time. We couldn't bring her on, but she did call in, so that was good. So nice to have you on. How you feeling? You good? You nervous? You okay?
Yeah, I'm a little nervous. I'm okay.
Take a
I
deep
got my
breath.
stress ball.
There you go. See, hey, there you go. So you have a few things you wanted to touch up on, and you know, just tell us, because Connie, you guys is in the front line. She's right there, battling it since day one, I believe, since everything went crazy, and Connie's been there. So it's nice to again now here we're gonna hear someone who's working on the front lines and with you're out in Little Pine, correct?
Yep. Yes, I am.
Yes.
Been with Battle River Treaty 6 since 2002.
Mm-hmm. Wow.
And even we were prepared for a pandemic for years. We were stockpiling stuff, and because they were predicting a pandemic every 70 years or so. And they said we were prime. We were due for one, and I never thought I'd see it in my lifetime. And here we are.
Yeah, you're just. We all hope that it would never. I you know, even before this pandemic came, you always see the movies, and you're just like, man, like that's so surreal, and just, you know, you never hope it happens, and then sure enough, it happens. But it seems that as human beings in general, you know, just not as First Nations people, but as human beings, we're adapting and we're learning to survive. You know, especially as First Nations people, you know what we've endured over the past couple hundred years. You know, this is just another thing for us to work through and learn from, and you know, passing this information that we are learning down when the time comes. So
Yeah.
so Connie, there was a few things you wanted to touch up on.
Bill just briefed me to talk. I'm not sure about that. What we're doing for vaccination. Things we've tried to bring up the numbers, but we're also noticing that gap is from the age 12 years old to about 49 years old. We're not really getting they're not breaking the doors down.
Are you guys going around offering rides to pick people up and all that stuff? Is that being offered?
Yes, yeah. We've had mass clinics at the hall, Little Pine Hall, and we've had mass clinics at the school gymnasium. So we've had mass clinics right at the clinic when people could drive up and honk their horn, and we'd run out and immunize them in the car. We even had a tent provided where people could drive through, and we would immunize them. What else have we done? We've had the urban clinics at Gold Eagle Casino
Mhm.
twice so far. We've even the most recent one was we got a van, the mobile van, and we've done home visits house to house and just kind of pop up surprising people. And does anybody want to be vaccinated in your house?
I was just I was gonna say a funny bad joke, but never mind.
But I'm really finding that we had a lot of success with that, right, Bill?
The pop-up?
The home visits with the van.
The surprise we got needles. Who wants to get
Yeah.
poked?
Yeah, because we had days at the mass clinics at the hall when
Mhm.
two people would come. Two people
Really?
would come, and then they weren't coming. And even with the drive-through right outside the clinic, we had days where 2 or 3 people would come. You know, so I think it goes to show that people didn't have rides.
Yeah.
People had the barriers. Maybe they didn't have childcare. Um, but I found when we would pop up at their homes, and they have this van and a whole team coming out, five,
Yeah.
6 people.
You're almost like you're catered to, eh? It's like
Yeah,
which is
it
good
seemed
though
like
in times like this.
yeah, it seemed like the people appreciated that. We would get some houses 3 to 5 people. They'd be getting everybody outside. Come on.
Hey,
Yeah.
you know what? Just considering that, like I live on my reserve here, and if I didn't have to go out of my way and I knew you guys are coming, if I had two options to go get vaccinated, or I knew the pop-up was coming with the van and everything, I would sit my butt there and I'd say, no, I'll just let them come to me. Because you're right, because you have all the other people in your house that are scared, that are just don't want to be around anyone else in case they catch COVID. They're feeling safe in their bubble. That kind of makes sense to me, that you would have higher success rate going to people's houses.
Mhm.
Are you guys more or less focusing on that now that you kind of see that an uptick in numbers, or what?
Um, I thought we had done well, but it seems like the numbers moved a little bit,
Mhm.
unless they're not being processed yet. But I'm still hoping we can have a couple days doing that in the van.
Yeah,
We finished like the north end of the community, kind of, and the central, and there's still areas that I
you're
would like to
you're
go.
talking about Little Pine, correct?
Yes, yeah,
Yeah.
yeah.
So with all communities, everyone in the comments, if you guys have any idea, any new ideas, maybe that they could probably consider that would bring more people to get vaccinated, sure, leave them in the comments. But
Mhm.
I just hearing that, I'm just running that simulation through my head. I definitely would have just sat home and waited for someone to come here and drive up and with the vaccine and then just make it real quick. I don't
Yeah,
know.
because
That's
it
just
worked
coming from my
really.
point of view.
Yes, it worked really well. We would pre-draw the syringes so they were secure,
Yeah.
and pack only so many in the cooler, and yeah, and then we take a lunch break and do the same thing in the afternoon. And
Mm.
yeah, it was. I really could have went on and on. I wish we could have went longer.
I was actually on that team, Nathan, on Little Pine, and it was a very enjoyable day with all the staff. We knock on the door, be polite, be friendly, ask if anybody wants to get the vaccine, if anybody in the house wants it. If they had doubts, we asked them to talk to our nursing team. We had 2 nurses. They would talk to them, and our success rate was actually going up. And like anything, we're still compiling the data, so we'll see our numbers go up because it was successful. And even if we only do one person, that's still a success.
Oh yes, yep.
Yeah.
It
I
seemed like sorry.
I think personally, so I'm gonna do it like that. I think personally that and I've heard this from a few people because I know there's a couple of my staff, my coworkers, sorry, that never got vaccinated because they want to wait and see. I think everyone wants to wait and see. And I know we had one of the questions there, somebody was about, if you get sick from the first dose, should you get your second dose? I had the effects, but a lot of my family members have gotten it and we're all good now. Like, everyone just seems normal, but I think people are still waiting while, and they're listening to those stupid videos where people are putting like a metal can and saying, look, it's sticking. No, it's not. You guys rigged it. You know what I mean? It's all that other fake news that Dr. Khan was trying to dispel and everything. That goes into the play too. But I think more or less it's a wait and see. They want to see what happens to everyone if they're growing third eyes, a fifth arm, all that
But
kind of thing.
what I'm leery about is, okay, wait and see until what? Until it's on top of you, until a family member is in the hospital, until, because it's that critical. We have one day some person's in the hospital and then they're with pneumonia, and it's unfortunately they weren't vaccinated.
Yeah,
So,
and I just found out my cousin and my niece have COVID right now, and they're battling it. So it's like, you guys, I know a lot of us are scared. You're scared to get COVID, and you hear some good stories through COVID that everyone just had the sniffles. Like my great grand aunt there, Margaret, she's 96, and she had COVID. Like one of the first people I think in Saskatchewan that got it, and she had the sniffles. Where you hear someone that's younger was just, they're almost on their deathbed. So it affects everyone different, no
mhm.
matter who you are. It just kind of affects you different. It's going to affect everyone different, but it's like, just go get vaccinated, and then we can kind of just start living a normal life. you
Yeah,
know, like that's
yeah,
kind of like we're all shooting for here.
or
You
go
know,
get tested if you have any cold symptoms like
yep.
sinusitis or anything. Yeah.
Yeah, and it goes back to don't be ashamed if you got COVID, man. It is what it is. I know we were shaming people at the beginning, not we, but I'm just saying this. People were being shamed when they caught it. And
Yes. Yeah.
now it's like, oh, you got COVID. Oh, okay, are you doing okay now? It's just good to go get vaccinated and just help fight that fight of not having to wear our masks anymore when we go anywhere.
Yeah.
I'm starting to walk into places without wearing my mask, forgetting it, but I'm just, I guess I'm just putting it out into the universe. I wanted that bad to back to normalcy.
Yes. Yeah. Unfortunately, we didn't have a chance to get into the schools to do vaccinations, but with Little Pine, they were doing online classes 2 or 3 days a week, and we didn't really know the schedule, and then they had funerals and stuff. There was a lot of interruptions. So I'm hoping maybe when the kids are home pretty soon, maybe we can catch them at home.
Mm-hmm.
Maybe with our van visits, I don't know. But
You
I do
know,
know it's not over yet. Yeah.
it's not over. And like I was asking Dr. Connor, like, are we going to be here forever, doing his podcast about it? But it's like, you know, this damn vaccine or this damn COVID. Um, Probably no questions stupid. No questions are stupid. Have you considered making draws for people getting vaccinated? Have you guys done that?
We've heard suggestions about that, right, Bill? And we kind of had conflicts about it because of course there's confidentiality and then the stigma you talked about. I've even heard some people say, well, I don't want people to know that I was vaccinated because they I've had one person tell me I don't want them to know that I was vaccinated. So
Mm-hmm.
there's a lot of confidentiality issues, Bill.
Yeah, absolutely right. This is still a health procedure, and we have to follow all the guidelines around Privacy Act. So we can't just say Bill Ironstam got vaccinated. He won a bike, right?
Yeah.
It's all self disclosure stuff. Though that being said, on our next podcast with Nathan, if you like and share the advertisement for it, I'm going to work this out with Nathan. I'm throwing this on him right now. We're probably going to give a book or two of tickets away to the next Chase the Ace draw, sponsored Battle River Treaty 6 Health. We'll buy those tickets, and whoever likes and shares will do a random draw so that we can get the word out and get even more viewers on this great program.
That maybe we should. Yeah, we should partner up. I'll ask the committee, but I mean, hey, go get vaccinated and you have a shot at winning $160,000+ Good.
Right?
Why not? Why not? It's better than a 20. Yeah, so yeah, just going on about this vaccine, and it seems like we kind of things are getting more and more open, I guess, where they're 150 now, people can gather outside, and I think we went through this thing last year. Remember, kind of when like around end of May, beginning of June area, kind of just seemed like there was no pandemic going on, and kind of everyone just kind of, I don't know if, but did you guys feel that last year was kind of just why? I don't know if Connie, because you were battling right in the middle of it, but I mean, as me, as someone who was just kind of living life, it seemed like that everything was back to normal. It kind of seems to me now that we're heading in that area.
Yeah.
Is it because it just summer's around and everyone just doesn't care anymore, or what's your thoughts on that, Connie?
Maybe they think with the open air and the airflow, there's less risk. I don't know. Yeah, but I'm not. Yeah, there's already some events going on that I'm still telling people to be cautious when I
Yeah.
vaccinate them because it takes 2 weeks to start fully working the vaccine.
Mhm. That's what I guess I should ask Dr. Khan, but I mean, Connie, what do you think about NHL games, NBA, all these big gatherings of 20,000 people in a stadium again, normalizing it? What's your thoughts on that?
Well, I'm hoping, like in the last podcast where Dr. Khan said he thinks it's because that they have a greater percentage vaccinated, like in the 90% vaccinated, because they have the vaccine companies there. So that's what I'm hoping for. I hope it's not because of any leftover Trump downplaying the virus,
Yeah.
But I heard it's different between different states.
Yeah, probably. I heard, correct me if I'm wrong, but I mean, I think we're in Canada, there's only 10 to 15% vaccinated or something like that. You guys know the stats on that?
No, not the up to date national ones. I don't.
I think next podcast, that's something we should bring up of what percentage Canada and a whole is vaccinated.
Yeah.
And maybe that's where people kind of clue in, because I know Vancouver, Alberta, there's like barely anyone going to get vaccinated because I don't know, the stigma against it and everything.
Yeah. Right now on the Battle River Treaty 6 First Nations, we're about 60%
In
vaccinated.
Saskatchewan?
No, our communities that are served by Battle River Treaty 6.
Oh, okay. Connie, got a question here. I'm gonna bring it up here by Daryl.
Yeah.
Oh, Connie and Bill, based on your experience on reserve, there were issues around individual rights versus communal rights. How did your COVID team deal with the issue? People don't want to get vaccinated, and these is unique as it's a national crisis. How will bands deal with those individuals not vaccinated and traveling all over in high numbers, etc.? What's the stance on communal rights trumping individual rights? What can a BCR? Oh, these are good questions, Daryl. What can a BCR may have as a federal power to ensure the well-being of? That's kind of where it ended. I'm guessing of an individual. So I guess just answer the one on the. I don't know if you guys want to. These are a more political question.
Well, right now we're still considering it everybody's choice. We're not forcing the vaccine on anybody. Again, it is down along the lines, your body, your choice. Right? What the communities do, I do not believe any of our communities have or will impose mandatory vaccination. We lived through that for the last 500 years, being told what we could and couldn't do. I can't see our communities continuing that type of thought process.
We just got the percentage there. Thank you, Janice. 14.9% fully vaccinated in Canada. Wow.
Right. I guess what I would hope for is eventually is that herd immunity. I don't know if you've ever heard of that, but there's some of these diseases that people think are eradicated, like smallpox or these old diseases from years ago, and they think we don't have them anymore, like polio. It's because the majority of the population is vaccinated, and that protects the small pockets that are not vaccinated. So I'm hoping eventually we get there, but I know, I think Little Pine was at about 52% last week,
Mm,
and it's the
vaccinated.
50 years old and up are doing well. They're like really vaccinated, but again,
Yeah.
it's that 12 to 40 years old that we need them to come.
Charity LaPlante, if you're still on, are you vaccinated or are you against vaccination? You don't have to answer. Kind of curious just with your comment there. Let me know. I think next podcast we should get somebody that is against the vaccination and kind of just have a conversation there, and it's not to put them on the spot. It's to hear both sides, because I know both sides, need to be heard. It's only right. So
Yeah.
that would be an interesting podcast actually, because then you're getting people that are from both sides. Because right now we're pushing the vaccine, right? You kind of want to hear the other people that don't want to get it and what their reasons are as well. So
On an up note, I noticed our numbers are like we've had two clinics at the hall this week, and we've had again the people are starting to come, but maybe it's because we've opened the doors to the second shots. Yeah,
mhm.
and they've it's because of that Delta variant. I think they're telling
Yeah,
people come now for your second shots
yeah,
to
the
get that
Delta.
immunity up. Yeah. So yeah, we are still doing a few first shots, which are great. Yeah.
So she's not vaccinated. She is against it. Charity, let me know. Would you be interested in possibly coming on the podcast end of June with Dr. Khan, myself, possibly Bill, Connie, and if we can get some other person that is also against the vaccination, just because, like I said, it you need to hear both sides, and people want to just sit there because there's Connie, Charity. There's many people out there that are on your side, and then I'm not saying on your side. There's many people that are against the vaccine as well, and then there's people on the other side that want you to get vaccinated. Like I said, it's good to hear both sides of the story, and we just need to have a conclusion at the end, kind of thing.
Well, one of the things that Dr. Khan said earlier, as you see the vaccination numbers going up in our communities, you're seeing the cases coming down. As in right now in the Battle River Treaty 6 health communities, as of today, we have no active cases, right? We're still doing our work around it and still being prepared for more to come. But because the vaccination numbers are up and are working, we do not have an active case right now, right? I mean, that's the proof that we're telling people, like that's the proof that the vaccinations work.
You're supposed to say that's the proof in the pudding.
I was going to say that, I had to stop myself.
Hey, why not, man? That's the proof in the pudding. But think Janice is just our stat person right now. Janice.
Put her on the payroll.
Yeah.
Oh wow.
9.6 worldwide fully vaccinated.
Oh.
So what is there, like 7.7 billion people? So that would be like just under a billion, or would that be a billion? No. Yeah, that'd be a billion.
There's a lot of third world countries where they haven't even seen the vaccine yet.
Yeah, they haven't even
High
touched
population.
it. Yeah.
We have a long way to go. Yeah.
Long way. I think we are getting near the end of this podcast, but I think how long, Connie? How long do you think we're going to be battling this? What's your personal opinion on this all? Because you are frontline, you kind of just see what is literally going on, what people are thinking or saying. What are your thoughts? Do you think we're going to be near the end of this by next summer, or get ready, here we go, see you in about 5 years?
Yeah, it's hard to say. I'm kind of a little anxious that, to be honest, I'm kind of thinking that I hope we don't see a fourth wave, come the fall. Like, are we at the tail end of a wave and then it'll pick up again? I'm hoping not, or I'm hoping that we get that herd immunity
Mhm.
pretty soon. But yeah, it's hard to say. I'm I'm anxious about it, and I'm passionate about it. Yeah, I
Mm.
want to get everybody. Yeah, but there, even with people contracting COVID, I'm not sure how long the antibodies last in their body against it.
Yeah.
So with the vaccinated people and the recovering ones, I'm hoping we get herd immunity by the fall. I don't know.
That would be very wonderful news. What about you, Bill? How long do you think
Uh,
we're in this for?
well, like I was saying earlier, everybody's seeing the light at the end of the tunnel as soon as they heard the word vaccination.
Hmm.
Unfortunately, my belief is that light is yellow. It's caution, warning, slow down. Um, I think at best case scenario, early winter.
Yeah, that soon.
Yeah, yeah.
Wow. Me personally, because I don't know much, I just kind of see what's going on and online and hearing from folks like you. I think I'm going to say conservatively, we're looking at probably another year and a half. That's just me. I'm not a doctor. I have nothing to do with the health field. That's just my guess. Another year and a half. I do think we're going to get a fourth and fifth wave. It's. I think it's just going to happen. It is what it is. I don't know, as much as you want to fight it, it's coming. But I think we're going to be a lot more prepared because we have so much information now of what's going on, how it reacts, and I know we're probably gonna get more variants, and just it just hope. I the only thing I really don't hope is that we don't have to take these shots anymore. But I know we might have to. But I just hope we don't have to. After we take them, I hope it's a one and done kind of thing. But
Yeah, the potential for a booster, much like the flu shot yearly, is a real possibility, right?
Mhm.
Much like your flu shot. Early on in this pandemic, back in like January, right when it was fresh, talking with Dr. Khan and his team, he originally thought 2 years, so
Mhm.
he's thinking 2022, right?
Yeah.
That was his 2 year prediction it would take for a pandemic, and
Mhm.
so far he's been very close. The science has been very close on this so
Mhm.
far.
Well, let's hope he is right, and we're all wrong, and it's near the end of this craziness. Well, I guess you predicted, Bill, at the winter. But I think we should be shutting this down, and I want you guys to know that we will be coming on again. I think June 30th, but stay tuned. But just take what Dr. Khan said, and if you haven't got vaccinated, think about it and read some more. And if you don't want to get vaccinated, that's your choice. uh Peace be with you kind of thing, and we hope you never do catch COVID, and
One more thing.
nobody wants any of this crazy. Oh,
One
go
more,
ahead.
yeah. Well, one more thing. One trend I've noticed is some people who've never taken the flu shot are now coming for the COVID vaccine. And they said, I've never taken the flu shot, but they'll come for the COVID vaccine. So I'm like,
That's
okay.
me.
So
That's me.
personally, I'm hoping they incorporate the COVID vaccine, the flu shot, like they have the H1N1, the Spanish flu. I'm hoping it's a
i
unit.
I was a firm believer against the flu shot. I never got the flu shot, like, ever. I was like, I don't even think that thing does anything. Why is the flu still here and we're still getting the flu shot? That was my belief, and I was just like against it. And yeah, now COVID came, and I just yeah, I was one of them people who got my shot.
Yeah.
Um, but yeah, we're gonna wrap things up here. So I guess Connie, if you want to say a few words, and then we'll move on to Bill, and then we'll close her up.
I think Patty was going to come on, correct?
Yeah, no, we'll come bring Patty. You guys stay tuned. Patty's gonna come on right after this. Go ahead, Connie. Say a few words.
Oh, okay. I'm just hoping for. I just wish that people would come for their vaccines. That age group. I don't know if there's anything you're scared of with the vaccine. Call the clinic. Talk to any one of the nurses at the clinic, or the family health workers. We have staff that can answer your questions, and Yeah, like I said, a lot of people that have never taken the flu shot are coming for the COVID shot and coming for their second shot, and very few side effects. So yeah, and we have lots of vaccine to use at the health center right now. And if we don't use it, and it's one of the best vaccines, it's a Pfizer, we could possibly lose it. We have had apparently some of it being asked back already from Health Canada or yeah, from the health bigwigs. Yeah, that's all.
Awesome. All right. Thank you, Connie. And you take care, and we'll probably see you at the next podcast.
Okay, thank you.
All right.
Night, Connie.
All right. We're going to bring on Patty, you guys, who is the executive director of Belford River Treaty 6. Is she there with you? I see her on here, but I don't see her on there.
Yeah.
Oh, there she is. Hello, Patty. Oh, you gotta unmute your mic there. You'll see an unmute button there. Just hit
Got
it. There you go.
I had to plug in my laptop. It was running out of juice. So
Okay. Welcome.
thank you. Lots
All
of
right.
good conversation there with Dr. Khan and Connie. That was really good.
Yeah.
Yeah.
So, how are you, Patty? Or how are you taking everything right now? I know you're running Belford River Treaty 6, and I wouldn't even want to be in your shoes when this whole thing started. I would have went nuts.
Well, it definitely has its challenges. I think as a team at Bow River Treaty 6, everyone was unsure of course, what was going to be happening with the pandemic, but we just knew that we had to provide the service to our communities. Yeah, and we had to do what we had to do to get the services out there. As far as the testing, we initiated that within months of the pandemic. Of course, our nurses had to get the training. We worked with SHA very closely to ensure that we were doing the testing properly. We had to get PPE. We had a bit of a shortage of PPE initially. I think there was a bit of confusion between the feds and the province as who would provide the PPE, but that was all straightened out rather quickly. The staff have been very just wonderful since the beginning until now. And I think I would like to take this opportunity to give them a shout out. And it's not just the frontline staff. They're out there doing a wonderful job, but it's also the support staff, the janitors. It's a team effort.
Mm-hmm.
And we wouldn't be able to provide the service without everyone's efforts. I mean, the support staff are there to make sure we have the supplies that are needed, ordering the PPE, even the finance and HR, making sure they're there to make sure we have enough funds, COVID funds, to provide the necessary additional surge capacity, or making sure we had sneeze guards for our vehicles. So it's just a team effort. And even the janitors taking the extra time to do all the extra sanitizing during the pandemic. So it's been a great effort from our team. And we have close to 100 staff at our agency. And just a good big shout out to them for being there throughout this. I think everybody's had their ups and downs. There were times where I just kind of wanted to throw in the towel, but you just have to keep on going and stay hopeful and support each other. And I think we do pretty good at doing that at the health center.
Yeah, you guys, speaking of throwing in a towel, goes into the mental health, and I think we're going to touch on this on the next podcast, but just to briefly touch on it now is like you guys have mental health services that were provided through the pandemic. You had your team there, at the same time you had all your nurses. You guys kind of had the one-stop shop for the what was happening here and providing that service to the urban and surrounding communities.
Mm-hmm.
Yeah. One of these for you guys. Right on. So it was just watching what happened transgressed, I guess, in the last year and a half to where we are now is quite simply amazing. I guess you can say that how everyone's come together and
Mhm.
you were tested. Everyone was tested.
Everyone was tested. Yeah.
No matter who you were in society, you were tested. Like no matter, right from the top to the bottom to the middle, everybody just tested, and you know, we hope we passed the hard part, and we're kind of coming on the down angle of what's in this pandemic. But what do you guys got going on? I know you wanted to come on here and talk about what you got coming up here soon.
Yeah, I just wanted to just say a few words about Indigenous Peoples Day. That's coming up on June 21st. And as you know, every year we do host a pancake breakfast. Unfortunately, because of the pandemic, we weren't able to host one last year, and nor will we be hosting one again this year. But we are going to be hosting a virtual event on Monday, June 21st through June 21st from 2 p.m. to 4:30 p.m. It'll be live streamed on our Facebook page from the Decker Center.
4:30 p.m.
2 to 4:30. Yeah, and it'll be live streamed through our Facebook page, Bell River Treaty 6 Health Center. And we have a lineup of 2 singers, stand-up poet, and then we wanted to remember the children of residential schools who never made it home because they were they perished. They basically were murdered right in residential school, and we wanted to do a special tribute and remember them and honor them, but at the same time celebrate the resiliency of First Nations people and have just a small tribute during the virtual event as well. So that's what I wanted to share today, and hopefully people will be able to join us on Monday.
Yeah, I forgot that was coming up June 21st. So that'll be awesome to watch. I do remember seeing the posters being shared, and maybe we'll get to hear even Bill sing a few songs there.
I've been practicing, buddy.
If you guys don't know, Bill and Patty are husband and wife. Maybe we'll hear an awesome duet by them too there.
Islands in the Stream.
Yeah, yeah.
No.
But awesome stuff. Well, thank you, Patty, for coming on and joining us, and maybe we'll get you to join us on the next one. And
for sure. Well, there was a couple times I wanted to chime in on some of those questions, but
yeah,
maybe next time.
Next time. Awesome. So we'll catch you on the flip side there, Patty, and I'll finish this off with the man with the plan, Billy.
All right. Thanks, Nathan.
Okay, see you. All right, there you guys go. This is a conclusion of Balfour River Treaty 6 Health Center podcast with information about COVID vaccine. We did have Dr. Khan on earlier. You guys can watch the video after, and then we also had registered nurse Connie Dillon, who's been with Balfour River Treaty 6 since 2002, and she's in the front lines, and she answered a few questions. And to my left here we have Bill Arnstein, who's what is your position at BRT6?
I am the emergency management coordinator.
Emergency management coordinator. There you go. So Bill's been in the front lines as well, battling, trying to get everyone vaccinated, and just trying to get more information out there. So yeah, we will be coming on. Is it June 30th or is it June 29th? Do you remember?
You were busy on Tuesdays, so I believe it was the 30th.
Okay, yeah, maybe it is the 30th. Yeah, I'm always live or something, doing something. Yeah, that's why I had to switch it. Yeah. But totally looking forward to it. We are going to promote it a little bit more, and we're going to be partnering up with Chase the Ace Treaty 6. You guys don't forget to go there. $160,000 plus. That's the one I co-host there as well. We raise money for the surrounding communities in North Battleford, the Treaty 6 area, and we're going to be giving away some tickets. Yeah. What else should we look forward to on the next podcast, Bill?
We're hoping that the vaccine numbers are up. So that we won't have to talk about the hesitancy and things like that. Maybe we'll have something to celebrate by then. Again, like Dr. Khan said, everything is changing. The pandemic is fluid, which means it changes minute by minute. So we'll have something to do. A couple things I want to share. I don't know if you can see them. Those are my two vaccination cards. I am frontline. I've got my first one in January. I was one of the first people here at our office, and I got my second one in February. I had no side effects. I had a little bit of a sore arm, if you want to call that a side effect. A feeling of awesomeness after and relief, honestly. And when that needle went in my arm, I had such a feeling of relief that I knew that I was starting to get some type of protection against COVID. I've had family members that did receive COVID. I had many personal friends that have actually passed from COVID. The late Victor Thunderchild was a friend of mine. A healthy young man caught it and he passed. This disease is not over. We're still in this fight. It's very real. We need everyone to do their part. Again, you have your own choice, but we really need everybody in the communities to take care of each other, be kind, and make sure that you do your part. One thing that Nathan had mentioned, that Battle River Treaty 6 Health, we have an amazing mental health department on each community. Everybody feels anxiety. Everybody was stressed. Myself personally, I hit the wall a couple of times in the past year through my work. One day I was sitting here staring at my computer. I realized that I had hit the wall. I couldn't do anything. I went and talked to my supervisor. I went and talked to one of our counselors. It was just nice to express the feelings that I was having. And I know for a fact that many of our staff members and community members have those very same feelings. So it's nice to have those supports out there, and Battle River Treaty 6 does provide those. Our amazing health staff, the nursing teams, like Patty had said, it is every position at our organization and in our communities is part of why we're being successful right now, right? From people who answer the phones to the people who are putting the needles in people's arms, we're all one big team, and we're working very well together. Fortunately, we do have a really good leadership. Our board of directors, our chiefs that are giving us direction and offering us the supports and the things that we need to make this a success are incredible. So Nathan, one thing I really want to thank you for giving us the opportunity to use your platform to spread the word around COVID and the vaccines, and hopefully we can continue this partnership moving forward.
Yeah, looking forward to it. I think I was kind of hesitant, but I was like, you know what, man, I think this is really needed, and this is what I really push podcasts for, because we can get the message, whatever kind of message we're trying to get out there. And hold on here, Daryl, I want to thank you right now. I'm going to personally thank you for joining our podcast, sticking it right through from the beginning to the end, and with your questions and everything. That's what we need to see. We need to see people involved in these podcasts, asking questions and just helping out in the process. So we learned about mental fatigue, and we all went into survival mode in our First Nations communities. Staff of all became the volunteers in most cases. Yeah, mental health is and it still is like it seems like I think I'm going to say it right now. I think we're only at the quarter way point of once this thing is over, of getting over the mental fatigue of COVID, and just, what it's done to everybody, in general. It's just a big one that we need to fight the fight. In Atlantic, early from Saskatchewan. Cool. Right on. We're gonna wrap
really good questions, guys. Everyone who asked questions today, really good. You helped. You made the podcast, honestly.
Yeah, no, that's what podcasts are about. It's about the people watching that are asking, because they kind of steer where we go with these things. But like you said, we will be back June. I'm gonna say June 30th. It sounds like that's the date, and yeah, we'll come back, and Dr. Khan will be back on, and there will be prizes, and it'll be some more information, and hopefully we'll have more people that want to tune in. But we are going to try. I'm going to tell right now. I hope we do have a couple guests on here on the screen that are anti-vaxxers and would like to come and share their part of why they were not going to get vaccinated. It would be awesome to hear their part of the story and just have a conversation about that as well. So, because like I said, we need to hear both sides of the stories. And yeah, it's everyone's right to, like Charity was saying, to what they want to put in their body. So going forward, yeah, Bill, I think I want to thank you for coming on, and we'll see you at the next one. And with everyone else, you guys, thank you for tuning in tonight, and be safe out there. Get vaccinated. If you guys have any questions, get a hold of Balfour River Treaty 6 area. If you're not in this area, get a hold of what number can they call? 811?
No, we have our COVID line. It's 937-6749. That's for anything COVID related, testing, vaccine appointments, just questions. If you're in any of the communities, you can call any one of the health clinics, or you can call the Battle River Treaty 6 itself at 937-6700, and you'll be directed to a health professional that can help you.
Awesome. All right, you guys, there you guys go. We will see you at the next one. Stay tuned for the information on that, and thank you for tuning in. Go get vaccinated. We're out of here. Peace.
Stay